a little below the level 5B. As we know, the level 5B is formed by the sternocleidomastoid, the clavicle, and the anterior border of the trapezius. The purple color shade shown here is our point of interest. Here we can see the clavicle, the anterior scalene muscle, and the middle scalene muscle. Let's now zoom into this area of interest. In this diagram, you can see the clavicle has been cut out, whereas the blue star is the first rib and the red star is the second rib. We can see the anterior scalene getting attached to the first rib and the middle scalene getting attached to the first rib, which is lateral to the anterior scalene. The posterior scalene is attached to the second rib. This triangular zone is our area of interest because two important structures passes between this. These are the scalene muscles, the anterior and the middle scalene muscles. In between that passes the brachial plexus nerves and also the subclavian artery. And in between the clavicle and the anterior scalene muscle passes the subclavian vein. Here we can see it very clearly that the subclavian vein is passing between the clavicle and the first rib, and there is the muscle, the subclavius. The subclavian vein is actually sandwiched between the clavicle and the first rib, with the subclavius muscle above. And the space between the scalene muscles is also important. Now let's have a sectional look into this area. There we can see the clavicle, and that's the attachment of the anterior scalene, and that's also the attachment of the middle scalene. And between the anterior scalene and middle scalene lies the brachial plexus. There we have the subclavian artery, and in between the clavicle and the first rib is the subclavian vein. Now let us answer a few anatomical questions. I hope you can appreciate this muscle. Guess what muscle is this? Well, this nerve bundle is very easy to identify. I hope you can understand what artery it is. Well, this is the vein, and this is the muscle. This area marked is called the thoracic outlet. If there is any inflammation, edema, or the collection of blood, that is hematoma, due to any pathology, cancer, tumors, or there can be fractures, these blood vessels and the nerves can get compressed, and this is called the thoracic outlet syndrome. There can be some other cause that can contribute to the thoracic outlet syndrome. And here you can see there's an extra rib which is called the cervical rib. Cervical rib can also cause compression, though it is not a rib, it is a pseudo rib because it is formed by the cervical vertebrae, especially the C7th vertebrae. In thoracic outlet syndrome, there can be a compression of the nerve, the artery, or the subclavian vein. So based on that, the types can be neurogenic, the venous type, and the arterial types. The neurogenic type, in this we have pain, the arm weakness is present, and there is considerable amount of paresthesia in the arms. And the venous type, which is the most common, which causes swelling of the arms, there is pain and sometimes a bluish coloration of the arms. As the arterial type, there is pain, coldness, and pallor of the arm. So let us have a review of the anatomy. I hope you can appreciate the structures and you know why the three types, the arterial, venous and the nervous types are present. Now you can visualize this syndrome in this diagram. So don't hesitate to take the quiz which is given in the description box. And I would suggest that you should try that quiz. It will enhance your knowledge. Thanks for watching.